Hey everyone, it's Zai and I am 2 weeks post-op and this is what my chest looks like. My nipples completely shed already. I think that's kind of soon because a lot of people I noticed didn't shed yet when they were 2 weeks. There's a little bit around the edges still going on. The incisions are a little less bruised, but they're pretty hard underneath. Along the incisions, it's just like the tissue underneath is hard. I hate it. And they go all the way back to here if you're wondering. I feel a little tugging in here sometimes when I move my arm a certain way, like as if the stitches are getting pulled or something. Right here it feels really weird, I really don't like it. But overall, I can do a lot of things now. I don't feel sick, I don't feel like I have a fever. Obviously I try not to reach anything past here, so grocery shopping is a little annoying. But for the most part, I'm fine. I can drive now. I want to say as of 10 days post-op, I was driving just around town, not for long periods of time. A little bit like this because I didn't want to spin my arms too much, but pretty good now overall. I can get up on my own, I can sit up on my own, I can stand up on my own. There's still a little tightness around here, but it's not like pain in the muscle. Because at first it was like a pain as if it was worked out too hard or, you know, some sort of muscle trauma or something, but now it's just a tad sore if I flex it, but it's really not bothering me anymore. Now it's just tightness around this area with the hard tissue underneath, I'm assuming, is trying to heal, and it's just pretty tight with the stitches. I would say if you do work a job to take 2 weeks off after your surgery, and you'll probably be good enough to do it after, unless you have a really high activity job or a job where you lift a lot, especially if you lift your hands higher, you would want to take longer off, probably at least 4 weeks or more. My surgeon said to not reach them any higher for at least 2 or 3 months than here. 6 months if possible. It'll help this incisions not get stretched and heal all stretched out. But that is something really hard to do, but at least a couple months, she said, so I'm gonna try my best to do that. In the middle of the night, I keep like waking up and my arm is like a little past here, kind of like that angle, and I'm just like, oh crap, and I bring them back down. I'm like, I don't want these to get stretched out, but I always sleep with my elbows up. It's a little frustrating. I'm not taking any pain medication at all. I stopped taking any pain medication after like day 3 or 4 after surgery. I really don't need it now though. Like, there's not even the muscle soreness anymore, really. I can set up like I said, so there's really no pain. Sometimes I get a little like some itchiness on the nipples because they're healing, or like a random little like sharp pain in the nipple or something, and then it just fades away, or like weird feelings in here sometimes. But overall, there's really honestly virtually no pain. I don't need to wear a binder anymore now, just when I sleep, so obviously I'm not wearing it now. I do have to dress the nipples though. They're not dressed right now because I just took a shower and I'm about to dress them, but I am putting aloe vera on the nipples and incisions, letting that dry, and then putting some Neosporin and gauze pads on. And they'll stay on all day, and I change them twice a day. Doing my nipples pretty freaking well though, honestly. They're doing pretty dang well. They're healing pretty fast. I am not smoking. All I smoke is weed, but I'm holding off on that because I know some people are like, oh, you can smoke weed now, but I'm just like a little like hesitant, so I'd rather just be safe than sorry, I guess. And my nipples are healing fast, and I'm not smoking, so I'm just gonna keep doing what I'm doing. Yeah, thank y'all for watching. Definitely hit the thumbs up, and I'll keep you guys updated on this, and I will have a lot more videos out, so